Hi everyone, I'm Dr.Jun, a physical therapist in New York City. I made this channel to share how to remember nerve innervations of muscles. This video will be helpful for somebody who already has basic knowledge of the musculoskeletal system. Before starting the series of videos, I want to prove that I can retain the memory of all the major muscles and nerve innervations with a method I developed. Just FYI, I don't have a photographic memory, so it will be easier for everyone to learn with this method. So I'm going to block my eyes first. Okay. All right, can't see anything now. So let's get started. Long thoracic nerve, serratus anterior, dorsoscapular nerve, levator scapula, rhomboid minor, rhomboid major, suprascapular nerve, supraspinatus, infraspinatus, lateral pectoral nerve, pectoralis major, and subscapular nerve, both inner vase subscapularis and lower core inner vase teres major, and thoracodorsal nerve inner vase latissimus dorsi, and medial pectoral nerve pectoralis major and minor, and musculocutaneous nerve 5, 6, 7 inner vase, biceps brachii, brachialis, and then coracobrachialis. And axillary nerve 5, 6, deltoid, and then teres minor. And radial nerve 5, 6, 7, 8, T1, triceps and coneus brachyradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digiti minimi, extensor indicis, extensor digitum communis, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus. And supinator, those are all radial nerve. Now is median nerve, pronator quadratus, pronator teres, and flexor carpi ulnaris, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris is an innervated ulnar nerve. Still, median nerve, flexor digitorum superficialis, and profundus median, and ulnar half and half, and flexor pollicis longus. And now thenar muscle, opponens pollicis, abductor pollicis brevis, flexor pollicis brevis. Flexor pollicis brevis half median, half ulnar. Adductor pollicis is ulnar nerve, and all ulnar nerve from now on. Abductor opponens digiti minimi, flexor abductor digiti minimi, flexor digiti minimi brevis, and palmar and dorsal interossi, lumbricals, and half median, half ulnar, and then palmaris brevis. And for the hip muscles, femoral nerve 2, 3, 4 innervates iliopsoas, and quadriceps, and sartorius and pectineus, and obturator nerve 3, 4 innervates adductor longus, adductor brevis, and gracilis, adductor magnus, and then sacral plexus L4 to S4 innervates quadratus femoris, gemellus inferior, obturator internus and externus, gemellus superior, and then piriformis. And superior gluteal nerve L4 5 S1 innervates gluteus maximus and minimus and medius and tensor fascia lata, and inferior gluteal nerve L5 S1, S2 innervates gluteus maximus, and siding nerve L5, S1, S2 innervates semimembranosus and semitendinosus, and siding nerve S1, 2, 3 innervates biceps femoris. Tibial nerve innervates popliteus and gastrocnemius soleus and plantaris. And then tibialis posterior, flexor, hallucis longus, flexor digital longus. Hallucis longus uses sustum taculum of Carcaneus as a pulley. And now deep peroneal nerve, extensor hallucis longus, extensor digital longus, and then tibialis anterior, and peroneus tertius, and extensor digitorum brevis, and peroneus superficial peroneal nerve innervates peroneus longus and brevis. And then now intrinsic muscle of the foot, bottom of the foot has flexor diastrom brevis innervated by median plantar nerve, and median plantar nerve innervates medial side of the intrinsic foot muscle, which is abductor hallucis and flexor hallucis brevis and adductor hallucis. Adductor hallucis is innervated by half median, half lateral plantar nerve, and then abductor digiti minimi, flexor digiti minimi brevis, and palmar and dorsal interossi and lumbricals and quadratus plantar. They're all on a nerve, except for the lumbricals, half median and half lateral plantar nerve. And then for the back and quadratus lumborum and iliocostalis lumborum thoracis, iliocostalis lumborum thoracis thoracis cervicis, and then longissimus thoracis cervicis capitis, spinalis thoracis cervicis capitis, and semi-spinalis thoracis cervicis capitis, and multifidi and rotators, longus and brevis. Intertransversalis cervicis, anterior and posterior, and lumborum lateralis and medialis, and interspinalis. And next one is serratus posterior superior and inferior. Those are innervated by ventral rami, corresponding to the level. And then for the neck, scalene anterior and middle is first rib, and then posterior is the second rib, and splenius cervicis, splenius capitis there. And for the anterior part of the neck, and platysma, facial nerve, and then SCM is axillary nerve, longus coli, longus capitis, and digastric, mylohyoid, stylohyoid, omohyoid, sternohyoid, sternothyroid, thyrohyoid, and then geniohyoid. And then for the neck muscle, like really tiny little muscles, rectus capitis anterior, rectus capitis lateralis, oblique capitis superior, inferior, and rectus capitis posterior major, rectus capitis posterior minor. And for the ab muscles, rectus abdominis and oblique externus and internus, and then transverse abdominis. And there is external and internal, intercostalis, and there's intermediate as well. And for the mastication muscles and temporalis, masseter and pterygoid medialis. And then lateralis is protrusion muscle, and I'm not going to cover the facial muscles and also pelvic floor muscles in this chapter, okay? So I think that is pretty much all the major muscles in our body. Hopefully this one motivates you guys, and then please watch the following lecture videos. I'm going to break down into different parts of the body, okay? Trunk, upper extremity and lower extremity, and then back muscles and mastication muscles like that, okay? So thanks for watching this and have a wonderful day.